heart valve disease is a disease of the heart valves, of which there are four, two on the left-hand side of the heart and two on the right-hand side. And if those valves become faulty, well, then they can lead to a particular group of symptoms that can cause problems for patients, and of course can shorten their life. So heart valve disease, in essence, in its very essence, is a disease process involving the heart valves, of which there are four. Those heart valves one of two things can happen to them really. They can become leaky or they can become blocked. And we refer to leaky valves as having regurgitation, and we call blocked valves stenotic or have a stenosis, in the same way we would with a coronary artery stenosis. And in effect, a leaky or a blocked valve can, over time, if it progresses and becomes severe, can cause symptoms for the patient and affect their quality of life, and can also shorten their life, and thus require treatments that range from tablets to valve replacement surgery. There are probably two peaks of heart disease. One happens to be in young kids and in babies who are born with congenital heart disease. And we don't hear a huge amount about that because they tend to be whisked off and treated very early in life and do very well. But certainly we're seeing a resurgence in heart valve disease in elderly patients. And that's because much heart valve disease is part of the aging process, in the same way as a hip joint or a knee joint might give you discomfort or cause you trouble later in life. A heart valve can undergo the same wear and tear or aging process and causes difficulty later in life. And while patients, of course, used to die from their heart attack or die from their cancer, the improvements that we've seen in care for many conditions lead to patients living longer, and therefore we see much more heart valve disease. In terms of screening, well, it's difficult because most of us throughout our lives will develop some form of heart valve disease. And of course, that can be classified as mild, moderate, or severe. And it's really only when we get to the severe level that it affects our quality of life, that it gives us symptoms, and it affects our quantity of life. And so the idea has to be, therefore, to not really screen for mild valve disease, but really try and find patients who are experiencing or at risk of moderate and ultimately severe heart valve disease. But certainly the most effective way and the cheapest way is the stethoscope exam. Echocardiography, or getting an ultrasound in your heart, is of course the most effective way of determining if you have heart valve disease, and if you do, what severity it is. But echocardiography is not widely available for GPs in the community, and therefore screening with a stethoscope and figuring out who's got a murmur and referring those patients for further assessment is the right way to go. Awareness of symptoms is very important for people in the community. If you're breathless, if you're having dizzy spells or blackouts, or if you're getting a tightness or a squeezing in your chest when you exert yourself, those three really are the cardinal symptoms of heart valve disease, and certainly something that the community should look out for. And if they're experiencing those symptoms, of course, a visit to the GP and a stethoscope exam is important. There are, of course, many other conditions, such as lung disease, COPD, coronary artery disease, and so forth, that can cause those exact same symptoms. But a GP can, or a doctor can usually figure that out, usually with some simple tests such as a stethoscope exam, a chest x-ray, some blood tests, and so forth. One of the things we very often see, even when people present with very severe and very advanced heart disease, is that they can, particularly elderly patients, be a little bit unaware of their symptoms, because because they feel that it's part of the aging process, they, for example, they stop walking up the hill when they get breathless, and they don't go out and they, you know, maybe take to the bed or whatever, rather than thinking this is unusual for me. I used to be able to do this a couple of weeks or months ago, and maybe I should get this investigated. So it's not uncommon for us to meet patients and we ask them, do they have symptoms? And they tell us no, whereas maybe their son or daughter is sitting in the chair beside smiling saying, he's unable to walk to the bathroom now because he gets breathless. And so we would simply get the patient out onto the floor of the outpatient department and get them to walk. And you can see very, very quickly whether someone has difficulty breathing when they're walking or not. So very important to understand what your symptoms are now. What can you do? And relate that to what you were able to do 6 or 9 months ago and see if there's a difference. TAVI stands for transcatheter aortic valve implantation. And that means that rather than open heart surgery, where you go for a general anesthetic, you have your chest opened by a cardiac surgeon and get put on a bypass machine, and where they will remove the old valve and replace it with a new one, and then start the heart again. That's the traditional way of doing surgery. It's been around for 50 years. It's very successful, but it can be tough to get through, and particularly for elderly and frail patients. And therefore, about nearly 2 decades ago at this stage, we developed transcatheter aortic valve implantation, which is really placing the heart valve not through the center of the chest wall, but through the leg, through an artery in the leg, and through a catheter. And this pretty much has revolutionized the treatment of heart valve disease, particularly for patients who have aortic valve problems. And what that means is that for the more elderly or the more frail patients, rather than sending them for an open heart surgery that either they may not survive or they will have a real difficulty getting back to their previous level of functioning, that we would opt to try and replace that heart valve through the leg. We initially started this process with very elderly and very frail patients, so patients over the age of 85, but we've subsequently done studies in patients down as far as 75 years of age, and it's been shown that this technology in those patients tends to have less death, less stroke, less kidney injury, less bleeding, less hospital stay, and a quicker recovery than traditional aortic valve surgery. And so in our institution, most patients who are over the age of 75 who need to have an aortic valve replaced would have a TAVI. If you're under the age of 75, you would tend to have traditional surgery. But of course, that has to be on a patient-by-patient basis, because some patients, for example, would have severe coronary artery disease as well. And we would elect to send them, even if they're elderly, maybe for surgery, because the surgeon would be able to do a bypass at the same time as doing a valve replacement operation. So all cases of severe heart valve disease in this institution are discussed together by the surgeons and the cardiologists. We come up with the right decision for the patient, involving the patient in that decision. But as a general rule, the more elderly and frail patients tend to go for a TAVI, which is a valve through the leg, and the more robust patients tend to go for the traditional open heart surgery. If you're worried about heart valve disease and you have those symptoms, which again are breathlessness or chest tightness or unexplained dizzy spells or blackouts, that heart valve disease, is a problem that can be diagnosed with a clinical exam using a stethoscope and then usually a follow-on ultrasound study. That heart valve disease is absolutely treatable. The vast majority of patients get a successful treatment and get home and get better and get on with their lives. And so if you're experiencing those symptoms, please present to your GP. Please present to your hospital if that's the case. So please don't be afraid to come to the hospital if you have symptoms. Your care can't wait. So come and see us. We're open for business.